So, welcome to the third episode of a Better Life podcast, where we'll be talking about vaccinations and deworming. We have a very special guest with us today, Dr. Brijesh, who's an integrative veterinarian. He also practices traditional Chinese veterinary medicine. Dr. Brijesh has roughly 20 years' experience, and thank you so much for joining us today.
Thank you so much.
Okay, so let's dive straight into it. When we first get a puppy or a kitten home, we normally bring them to the vet for a general health check, but also that's when the vaccinations happen. So,
Yes.
Can you tell us a little bit more about the different vaccinations and the timelines within which they need to happen?
Sure. But just something before that. When I started practice a couple of decades ago, we used to actually, home breeding used to be a thing still in Mumbai. So we used to actually go and wet the puppy, look at the dam, the mother, perhaps the sire as well, if possible, and then help the client select. Now that's not a thing anymore, and invariably they just arrive. So the first contact with the pet parent or caregiver would be when the puppy arrives at their door. That, I must say, is less than ideal. It also depends. A lot of breeders will give their first vaccine, the puppy DP, at 4 weeks. And what we do is, depending on what the gap is, we'll kind of give it a few days for the puppy to relax, settle down, assuming that it has passed the initial fitness test, is the initial physical. And then we will give the shots at, say, 6, 9, 12, and 15 weeks. That's the 7-in-1 or the 9-in-1. And after 12 weeks, generally we'll give the anti-rabies. I like to keep a gap between the 7-in-1 and the anti-rabies, perhaps of about 10 days. So you're not overstressing the puppy. And thereafter, it's like an annual revaccination.
Yeah. And generally, until the puppy is fully vaccinated, what are the do's and don'ts?
So unfortunately, I'm in a constant tussle with the trainers who say, no, socialization happens till 16 weeks, but that's not something that I allow. The problems that we face, the challenge that we face, is maternal antibodies can last till 16 weeks. So therefore, 15 weeks is the last shot that we give. Ideally, it is 16. And it takes about a week to 10 days. So you're not going to take this puppy out of the house unless you have access to a basement or a terrace or a garage space, basically an enclosed space where no other dog, I'm talking about puppies right now only, but where no other dog has pooped, peed, coughed, sneezed, any of that. Because some of the viral particles, the fomites, can remain for a very long time, especially for parvo.
Okay, yeah. And what about kittens? For them, the set of vaccinations are different, right?
Yeah. So for kittens, we give the first vaccine at 8 weeks and then at 12. That's the booster for the PCT. So PCT is basically for feline parvo and also for respiratory callusi and herpes virus. And we give similarly the anti-rabies after 12 weeks. And then it's again, and I still follow annual revaccination. There are conflicting thoughts on that. Some people say that the vaccine lasts for more than 1 year. Unfortunately, I still don't want to take a chance because especially herpes virus is very prevalent, very common. And even after the vaccination, you can get a mild form depending on exposure.
Okay. And even if the cat is like a house cat, you still would err on the side of caution and say yearly.
So I'm comfortable with staggering the vaccine by a few months unofficially. But officially, I have to advise a yearly vaccine.
Yeah.
Abroad, if the country is not endemic and if the cat is strictly indoors, then the PCT really it's kind of allowed to be given once in 2, maybe even 3 years.
Okay.
But here, we're still looking at annual revaccinations. I'll probably stagger it by a bit.
Okay. So, for the new pet parents out there, sometimes, you bring a new puppy home, you start the set of vaccinations, and they may sometimes miss what a parvo or a distemper looks like. So, Can you maybe describe what it looks like so that,
So, at the risk of scaring our pet parents here, I always advise them to first, it's like a baby. Just get comfortable with what is normal, what is healthy, right? So I would advise them to look at the eyes. Is there any discharge from the eyes? Look at the nares, the nostrils. Is there any discharge from there? What kind of discharge? Is it yellow? So if you have yellow discharge from the eyes or the nose, you're looking at an immunocompromised or an underdeveloped immunity, and then you're looking at an immunocompromised patient. Um, in some puppies, not all, that might be early signs of distemper, might be. It doesn't have to be, it might just be a secondary infection. You also look at pustules on the abdomen. That can again be just because of a heavy worm load and in a compromised immunity, but that also can happen. Since you brought up parvo and distemper, I'll just gloss over very quickly. Parvovirus is very typical. Again, starts with fever, dullness, puppy who's running around, zoomies, wanting to eat everything, chew, suddenly becomes quiet. It'll suddenly become dull. It'll suddenly just be sleeping a lot more than normal. Uh, Even if you are a caregiver that doesn't understand disease or doesn't know, you still know something's wrong. That's when you need to call the vet. Do not let the vet tell you, let's wait a day, but do not take that decision on your own. So there's an incubation period. This is the most common thing that happens. If you get it from a breeder where there's been an outbreak, because parvovirus particles last for up to 6 months in the environment, it's very difficult to destroy. Okay. Although virus particles in general are easy to destroy, they're delicate, but parvo can last if certain practices are not followed. So the puppy might arrive at your door totally healthy, apparently healthy, and then suddenly that incubation starts getting over. From the incubation period is from exposure, first contact, to actual expression of disease. So that'll get over, and then you start seeing dullness, you'll start seeing the fevers, you'll start seeing the occasional vomit, which will then progress alarmingly. Because the puppy is nauseous, it won't want to eat. Initially, it'll try to eat, then it'll bring it up, it won't stop. After some time, capillaries will rupture and you'll start seeing blood. It'll start passing fetid, foul-smelling stools. You'll see blood there as well. So it's a very typical presentation in parvo. In distemper, what happens is you have very high spikes of fever, and it's like twice a day, in the morning, in the evening, and in between it might be normal. So that's a little more difficult to pick, because you'll say, oh, he was dull in the morning, but now he's fine, he's running around. And then again, he's dull in the evening. So biphasic fevers are known. You can have discharge from the nares, from the eyes, which are yellow. Like I said, you can have pustules, you can have respiratory issues, a cough, which can progress to a pneumonia. You can have some gastrointestinal issues, maybe a diarrhea or a dysentery, and then over a period of time that can progress to a neurological problem. So the prayer is that the puppy has not been exposed to a very high virus load and is able to get rid of that on its own. And then the virus just finishes its cycle and localizes somewhere in the spine. That happens. Now, depending on which level it localizes at, you will see neurological signs. So the worst will show back leg, hind limb paresis or paralysis, or you will see twitching of the muscles, involuntary twitching, especially some dogs when they're anesthetized for future neutering surgery, or if they're just sleeping, that's when the twitching happens. But severe cases, you'll just see muscle fasciculations, twitching. Yeah. So these are the two most common diseases, unfortunately, in Mumbai that we see.
Okay, so let's talk a bit about senior pets. Do you generally recommend like a yearly vaccination for an older dog or cat, or one that might have like a chronic disease,
So I'm going to pull out the Chinese answer to that, and that is depends. Okay, it's a very individual question and an answer. You're looking at what is the health status. I don't believe in chronological age. For me, biological age is important. So some dogs I've seen with white muzzles at 7 years of age, and I've seen some dogs who are really, really good looking even at 14. So it's something which is very individual, depends on the fitness, and it goes back to that first thing that I said. What is the breeding line? How strong is the immunity of the puppy when it came? In TCVM, we call it kidney jing, the energy that the puppy is born with. So, like coming back to your question, you're looking at yearly, the initial puppy vaccines. Then the first year, you have to give the booster. There's one school of thought which says, okay, you've done that, that's going to last for a certain number of years, and after X number of years, you can again restart vaccination. Legally, we are not allowed to do that anyway in Mumbai. because you don't get a license without an annual revaccination. So we kind of tend to vaccinate annually until the dog is really senior. And then if you are concerned about over vaccinating, or if you have a very, very tangible physical issue like a kidney problem or a liver issue, the veterinarian can write up a note excusing that dog from vaccines. Probably the medical legal advice would be to do titers, look at what the antibody titer, do that periodically, because an old dog is as good as a puppy, right, immunologically. So they are at risk as well. So it's a bit of a balancing act. You have to decide. Of course, if it's a really old dog having difficulty walking, standing, can't go out for walks, is not going to be exposed, then that's something that you can take a decision a lot more easier. The decision becomes a lot more easier.
Okay, yeah, thanks for that. Now let's talk a little bit about deworming. So
Sure.
I remember when I first got Leo, my puppy, he had like a little pot belly and, had live worms in his stool. So essentially, like, there is obviously a difference in the deworming schedule for a
Yes.
puppy and an adult dog. So yeah, if you can.
So that's my Chinese answer. Depends. If you have the worst case scenario on the spectrum is an indie rescue, because they inherit a heavy worm load, just as Leo was.
Yeah.
They inherit a heavy worm load in utero. Okay. So they're born with roundworms, which have moved via the mother's maternal placenta into the puppy. And then even whilst the mother's lactating, right? So it also harks back to the breeder practices. Was the dam dewormed before conception? Was she dewormed shortly after delivery of the puppies, so that you minimize the larval load that the puppy is exposed to? So as a veterinarian, it becomes a little intuitive, at least for me. So what I'll do is look at that puppy. If there's a pot belly, and it's a very obvious pot belly, and if it's an indie dog, or for that matter a cat, I know that cats will have a heavy roundworm load. And if the cat has fleas, it's going to have a tapeworm load as well. So I will then proceed to deworm very gingerly. Okay, I will use an underdose. The first dose for me would be an underdose. It would not be by the textbook, and I'd probably use a low dose of steroid just to protect it from what happens when the worms die. And these products are kind of effective, very effective. Two things can happen. One is the roundworms can form a clump, and that causes severe colic and sometimes even obstructive issues. And sometimes they get digested over a period of days, a few days. And those metabolites that are released cause vomiting, diarrhea, severe nausea, biliousness, all of that. So it was very interesting. I recently saw a cat dewormer suspension, kitten dewormer from overseas, I forget the trade name, which came with a liver supplement with it, incorporated. And that corroborates what I've always suspected, that it causes a bit of biliousness, a bit of liver insult. I won't say damage, insult, because the drugs are metabolized and excreted via the liver. So the puppy or the kitten really get very low after that first contact with the vaccine. And then after that, the official recommendation is to deworm once in 2 weeks. I tend to stagger it because I'm really concerned about worm loads here and also about liver health. So I tend to stagger it by a couple of weeks maybe. So if I know that it's come from a good breeder or a kennel, and I know that, okay, it's not a very heavy worm load, then it's going to be monthly up to 6 months of age, and then once in 3 months. So that's what I would do. You have various products. You have Pyrental, which will kill roundworms. And that's something that I use because it's a single product. So you get combination products as well, and they're very effective. But that becomes a bit of a problem sometimes if the worm loads are very high, like I explained. So you have to walk that tightrope. Okay. Have I answered your question?
Yeah, so okay. Cats and dogs, generally, like a healthy cat or a healthy adult dog, it would be like a quarterly deworming schedule.
Yes, an adult I would probably look at, unless in a cat or a dog for that matter, unless they get a flea infestation. Okay. So what they do is they self-groom. The flea contains the larval stage of the tapeworm. They swallow it and then they get the tapeworm. In which case you have to do it a little bit more often, couple of times perhaps. A caveat also is if somebody in the household is starting a family, if there's a lady who's expecting, then you need to deworm much more aggressively. You need to advise her not to pick up after the dog or cat, or at least use gloves and then wash with soap and water very thoroughly, because parasites are a potential problem. So you need to be careful about that. Not just an expecting mother, but also an immunocompromised patient, like somebody surviving cancer or undergoing chemotherapy. You need to be very careful about these things because they don't have the normal immunity of an adult.
Okay, so I mean, say if you had a puppy like me who had such a high worm load, would you deworm yourself as well? Like if you're, handling the puppy and things like that?
If I have not been dewormed ever, I'd probably deworm one time. I'm not so concerned about because you maintain basic hygiene. That is to say, you're not going to pick up with your hands and you're not going to eat after that, right? So the chances of you getting contaminated are very small. So I'm not really concerned about my worm load, but if there is somebody, like I said, who's expecting or something, I'm not going to take any chances. So I would be very careful.
Yeah. And I mean, what's your take on homeopathic dewormers or like any alternative treatments that are there for deworming?
So I'm not an expert on homeopathy or, I've heard of various alternative. Recently, we were at a lecture by a homeopath, by a discussion, and she was talking about using homeopathy prophylactically. That is to prevent, a reinfestation with worms. And perhaps that is good. But the problem with that, the challenge that I have with that is, from what little I know of homeopathy, you need to give it every day for up to a month, is what I had read somewhere. In which case, owner compliance becomes a problem. So I don't know somebody who will remember to do it every day for a month. But you have various things. So if, for instance, a dog does not tolerate, I do have a couple of dogs who cannot tolerate the really effective dewormers, I'll probably climb down to something which is less effective. Or even if that is not tolerated and the dog becomes allergic and intolerant, I'll probably go down to alternatives.
Yeah, yeah. I mean, I had a friend actually who lost a dog because of a liver issue, and we felt that perhaps that quarterly deworming protocol that was followed at the time may have been a little bit aggressive for that dog.
So that's what I was saying, that even whether it's a dog or a cat, the deworming medicine itself, allopathic mainstream deworming medicine, can be a little rough on the liver. So you have to be a little careful. It's a transient insult to the liver. It's not something which will, and this is the problem, because the challenge for me as a professional is, do I follow the textbook or do I look at my patient and tweak as per requirements, right? I think the answer is always in between. The truth is always in between. You look at your dog or cat and decide what dewormer you're going to use. You have a whole range now. We are spoiled for choice a little bit. And then decide when you want to use it and how much, right? And then decide. So I think one of the easier ways to decide would be to do maybe 2 or 4 times a year. You can do fecal examinations. So you can look at just a stool sample smear exam, but that will give you only this much information. Probably the gold standard would be to look at a flotation test, which would throw up eggs. So you look at the egg count and then decide what you want to do and when you want to do it. I think that would give you a good indice, a good indicator of when and how much.
Okay, yeah, that makes a lot of sense actually. So thank you for that.
Thank you.
I mean, before we end, I think let's talk a little bit about traditional Chinese veterinary medicine.
My favorite, yeah.
Yeah.
So, like I said, when I started work initially, I was a hardcore mainstream allopathic Western veterinarian. And then over a period of time, I began getting cases where it was frustrating or you hit a ceiling, okay? Especially the chronic cases. And I think more and more I began realizing that there is no one system that is all-knowing or all-solving, if I can use that term. So I like to integrate both traditional Chinese veterinary medicine and allopathy. So chronic cases, for instance. So if it's an emergency, sure, you have to go in for Western medicine. But if you're looking at a chronically ill patient who's going through rebounds, and you're constantly having to take recourse with a limited number of drugs, which can then potentially throw up side effects, and it's not going anywhere, you're not solving anything, you're just managing it, okay? Then I think you have to look at alternatives. So what I've studied is traditional Chinese veterinary medicine. One of the most common unfortunate problems that I face, and the good thing is I can help with TCVM, is Labrador German Shepherds with hip dysplasia, joint disease, spinal issues. So I use acupuncture a lot for that. I even use it in cats. Cats are a little harder to needle, so I use laser acupuncture. So these then minimize the dependence on allopathic drugs, the non-steroidal anti-inflammatories or the steroids, which can potentially throw up side effects over a period of time. So in the West, they would look at using those drugs indefinitely in an old patient because quality of life and being pain-free is more important. But I as in TCVM, can offer the option of a better quality life, a happier pet, without those drugs. So what they do overseas is they use a combination of acupuncture, tuina massage, which is also what I offer, and herbs and food therapy. So we use a combination of all four. Herbs, Chinese herbs are not available to us easily, so that's something I don't offer as of now, but I definitely use the other three. So all three are very interesting. As a nutritionist yourself, you'd know that how important food is, the medicine you take every day. So it's really, really important. And what TCVM does is it tweaks it for the individual pet. So if you have a liver issue, you have a diet that's tweaked for that, or kidney issues for that. But what I find the most exciting of all is you can put together a diet based on the personality of the pet and your geographical location and the season. And that is preventative medicine. That's my area of interest. If possible, I would like to prevent a condition from happening rather than being at effect, which is what, unfortunately, we are at most times for a variety of reasons.
Okay, thank you so much for being
Thank
here
you.
today.
It's been a pleasure.
I'm sure all our viewers are going to find this super helpful. So thank you guys for tuning in to this very interesting session that we had with Dr. Brijesh today. And we hope to see you soon. Watch this space.
Thank you so much.